Hey, everybody. Good afternoon or good morning, depending on when you're listening to us. I'm Swati Shah with Plans Connect. Welcome to the mid month meeting of the minds. I have Tina Gunaldo here with me, and the story of how we met is quite impressive because it underscores the value of networking on LinkedIn. Tina, take it away.
Absolutely. Thank you for having me. And so I think we should get right into it, but I'll just say my name is Tina Gonaldo. I am a physical therapist by training. Swati and I met online, actually on LinkedIn, when I used to work for my previous employer. And we had different divisions within that organization. And she just happened to tag the department that I worked in, which was not the department she needed to or wanted to. But and I just messaged her back and I said, "Oh, looks like y'all are doing wonderful things. Let's connect." And so then we actually did. We connected, we stayed connected. We had a phone conversation. We've met a couple of times for coffee here in New Orleans. And then we're back again together on your podcast. So thanks for having a space for us to share our stories.
Yes, I'm so excited to have you. I loved the work you do. Everything I see you post on LinkedIn about interprofessional education. I am a firm believer in cross collaboration. As you know, that's part of why Plans Connect was founded, because we all in healthcare have so much to give. We have so many talents, so many skills, and how do we keep using them? And one of the ways to figure that out is by networking online via LinkedIn. And so, tell me a little bit more about your work in interprofessional education.
All right. So I always have to thank there is a single person who is now one of my best friends for engaging me in interprofessional education when I used to work in an academic health sciences center. And it was going through a lived experience with her and a family member that really got me engaged in the concept of working across professions. Because when you're in school traditionally, and I believe I said this already, that I'm a physical therapist by training, but when you're in school, you go through your courses, right, with your cohort, but very rarely do you have the opportunity to interact with individuals from other professions on a regular basis. So that's what interprofessional education is all about. It's preparing the future healthcare workforce to be ready to collaborate and to not have those typical challenges of stereotypes and hierarchies that we deal with in healthcare that inhibit collaboration. Since that time, last year, I want to say it was approximately last fall, I moved into back into the clinical practice setting. So no longer as a physical therapist, but I am working within a healthcare system, and a portion of my title is health equity, and then the other portion of my title is to support interprofessional collaborative practice. So how do we prepare future healthcare for workforce individuals, right? Students and learners. And that was my role for so many years. And then now I'm actually in practice making sure that we continue that collaboration. It doesn't look the same in terms of education and training, and then coming to those who are already providers and professionals, but it's to make sure that we integrate those core team science, is what I call it, communication and collaborative practice strategies into the workflow so that we support collaboration within health systems. We're not necessarily training for it, but we support it, which is a natural training process. It's not so formalized. I think that's the best way to say it. And I'll just say one more thing before, because I know you have a question that you want to ask. So, in my current role, that's what I do. But how Swati and I stay engaged on, or how you and I, right, stay engaged on a daily, weekly basis via LinkedIn is because I have my own business as well. It's called Collaborate for Health. It started approximately 3 or 4 years ago. Officially, it started last summer in terms of when I registered everything. But I've been doing this because I wanted to get the word out about team science and how it doesn't matter if we're a student, doesn't matter if we're a professional, but we can always learn how to better communicate and collaborate across different professions. So I'll stop there and hand it back over to you.
I think that's fantastic. I mean, it's true. When we go through our training, whatever healthcare profession, I went to medical school, became an OBGYN. Nobody really focuses on the intercollaborative experience. And it's really important if you have a very sick patient that you learn to collaborate with the other specialties. If you have a pregnant woman in the ICU, you need to know how to communicate with the pulmonary critical care attending and function effectively to provide your patient the best care possible. And it extends across all specialties and all industries. So, for example, I worked in the pharmaceutical industry at two different companies, and I've been a speaker at another one. Um, and one of the things I found quite remarkable, I did some cross collaboration unintentionally because for me, it's natural to reach out and connect with others. We had a slide deck that was meant to display public health data on women's health across the United States. And the slide deck was meant to be interactive, but it was not working in the format we had it.
Mhm.
And in order to make best use of the company's tools that we were given to use in the field, I needed to talk to the IT people who not just designed the software, but also the people who uploaded it for us to use. So where there was a lot of platform interfacing. And I didn't think I did anything unusual. However, my manager was so impressed that he nominated me for an award for it. And I thought, "Oh, I was just making the tool you gave us functional." And so that underscores the value of cross collaboration because that enabled my company to reach out and connect with other physicians with that public health data and women's health that was so key to share in terms of our work and their work and then overall population health. So that's just one example. Yes, we have stayed in touch via LinkedIn. I want to thank you, Tina, for supporting everything we've been doing at Plans Connect. I think your insights when you've come to the Socials for Science in New Orleans, um, what's the word I'm looking for? Keynote for everyone. Both Tina and I are located in New Orleans, so it's a little sunny. It's a little warm today, but I think it's fabulous weather. And we're both in New Orleans, so that makes us uniquely positioned to spread the information on the value of cross collaboration at in-person events that we may have in the city or in the metro area. And there's just so much more we can do, but uh, it's not just restricted to being in person. As Tina and I are here on a podcast. We're not sitting actually in a cafe. We're on a Zoom together in our respective homes. And um really it was the LinkedIn community that helped pull us together. And it was my first pilot event, Tina. I don't know if you knew that, but my first pilot social event, we had about 30 people at the International House Hotel. I had specialties all across the board from public health, social work, anesthesia, retired microbiologist, um, people who did research and user end experience. I had a cytology tech. All sorts of people came. And granted, a lot of them were my friends, which shows the power of my networking connections. And but it was a really well attended event, and it was held at the same time as a national conference in New Orleans. And that's why I was trying to tag everybody. One of my friends was a midwife at the time in the School of Nursing at LSU, and so I was trying to tag the right department for her, and I didn't succeed, but anyways, it brought us together. So, yes, that was our first pilot event, and I thank you for all your support all throughout. Let's talk about what else we can offer for people who are listening in. What sort of workshops do you offer in your personal or in your private venture?
Yeah, so I would just say this is that Collaborate for Health was really meant to start to bring forward the science that we have in terms of interprofessional collaborations. And so, what do you need? What are the pieces and parts in order to make a high performing team? I'm not going to say easy, but how do you help build that high performing team with ease? Because so many times we struggle with interactions, and people will say, "Oh, the people I work with in that group, it was very difficult to do so. Some people did their job, some people didn't do their job." But as individuals, we just really have not been taught the knowledge about what surrounds teamwork, what surrounds communication. But then as managers or administrators, we haven't been taught that science either. It's just gather it as we go along in terms of experience, but no one's really packaged it all in one. And so what I've done is looked at all the literature across retail, across engineering, across healthcare, et cetera. And every article basically that's written about high performing teams, I would just soak up, read what was going on, and look at the discussion, right? Look at the research question. I have to say this because probably most people don't know this. While I said I was a physical therapist by training, I also have my PhD. And so this is where the research is important for me. But I would just kind of pick apart and go, okay, what are the similarities between these articles across industries? What are the differences? And so what I did was align then all of that information so everyone doesn't have to do it themselves. And I put it into something called the Guide for High Performing Teams. And so that is what I use as the basis of everything else that I do. So whether I have individual consultation sessions with managers or individuals in regards to wanting to further develop the team that they have, is usually what the request is. Or am I a keynote speaker at a regional or national conference in regards to these topic areas, just keep spreading the word. That's really what I do. One day I would like to create a workshop, Swathi, but I'm not there quite yet. Um, but I will get there eventually because it is something I'm passionate about. I'm very fortunate to have educated as many students, pre-professional, right, students over my 10 years in within the interprofessional education space. And once again, very grateful for having to have done that and have had that exposure. But there's so many more healthcare providers and professionals out in the workspace that I knew there had to be an opportunity to get that message out. And so that's what I use LinkedIn for. And the last thing, I just want to build upon what you said before in terms of what are the benefits of LinkedIn and why is social science and Plans Connect such a great thing to be on LinkedIn. It's like I said to another colleague the other day. It's just if you're doing something in interprofessional education or interprofessional collaborative practice, just put it out there on LinkedIn. It doesn't have to be this nice, pretty post. But what we're trying to do on LinkedIn is just learn from one another. And that's something while you and I live in the same city, we still have colleagues on the West Coast, on the East Coast, in a different country, right? We're that's
Absolutely.
separated by water even. And we couldn't do that years ago, and now we can. So if we can all start to do our part, if you are interested in being on LinkedIn and just sharing what you do, it's just an opportunity to learn from one another. And it's just another way to be able to engage with others, hear their perspectives, and then try it in your own organization or your own home. So anyway, I'll stop there.
No, that's a great point, and I do encourage everyone to be on LinkedIn. LinkedIn was designed to make individuals more productive in the workforce. So whatever your workforce is, whatever your life is, it's designed to support you. So, yeah, I think it's a great thing, and I do offer workshops on LinkedIn. They're one-on-one. I have 2 virtual Zoom webinars coming up, May 7th and June 4th, and if someone wants to follow along on the Plans Connect website, or you can look on Eventbrite, all of our events are linked to Eventbrite, so you can always sign up and see what's on there for a Zoom or an in-person workshop, and people are always welcome to come if they're in the right city at the right time. So thank you, Tina. It's great having you on board. I look forward to more cross collaboration with you because interprofessional collaboration is the key.
It is. I agree with you completely.
So thank you. Thank you all. Have a great day.
Everyone.